For many years, I have seen my peers, my family, my friends suffer with sleeping disorders. Every day, turning around in their beds unable to sleep, or falling asleep while doing some simple homework. I have never been able to understand their suffering, or if there's any cure, or what causes these sleep disorders. For this reason, I have created this documentary to inform all of you about the different sleep disorders, such as insomnia, sleep apnea, night terrors, and narcolepsy. I hope you enjoy.
I've had a tremendous amount of difficulty falling asleep. I've had to deal with this on and off for about 30 years.
It's important not to look at a clock. You don't want the clock to look at you. It's not even like you look at the clock. It's like the clock is coming to get you, and it's taunting you. The clock is looking at you.
Insomnia, also known as the persistent inability to fall asleep, has these different symptoms. First is the difficulty to fall asleep. Also, waking up often during the night and having trouble to fall back asleep, waking up too early in the morning, or feeling tired upon waking. There are two types of insomnia: acute insomnia, which is in the short term for a short period of time, or chronic insomnia, which can happen for months or years. The different causes for acute insomnia could be significant life stress, illness, emotional or physical discomfort, environmental factors like noise, light, or extreme temperatures, and interferences in normal sleep schedules. For chronic insomnia, these include depression or anxiety, chronic stress, or pain and discomfort at night. The only treatments are pills, not over the counter, or practicing good sleeping habits. Yeah. Well, sleep apnea is also known as the failure to breathe while asleep. Untreated sleep apnea can increase the risk of high blood pressure, heart attack, stroke, obesity, and diabetes. It can also increase the risk or worsen heart failure, make arrhythmias or irregular heartbeats more likely, and increase the chance of having work-related or driving accidents. There are different types of sleep apnea. Obstructive sleep apnea, the most common, and occurs when the throat muscles relax. Central sleep apnea, which occur when your brain doesn't send proper signals to the muscles that control breathing, or complex sleep apnea syndrome, also known as treatment emergent central sleep apnea, occurs when someone has both obstructive and central sleep apnea. The symptoms include loud snoring, episodes of breathing cessations during sleep witnessed by other persons, morning headaches, awakening with a dry mouth or sore throat, difficulty staying asleep, which is also known as insomnia, and excessive daytime sleepiness, hypersomnia. Some risk factors are type 2 diabetes, daytime fatigue, and the possible treatments are lifestyle changes, for example, losing weight or quit smoking, therapy, or surgery.
Terrified it really bad to where I wouldn't even go to bed at night. I'd stay up all night long just so that I wouldn't have to go to sleep, so I wouldn't have to experience that again.
And I remember waking up and being like, don't move. Whatever you do, don't move.
Night terrors are the sudden arousal from sleep with intense fear and accompanied by physiological reactions such as rapid heart rate, perspiration, and it occurs during stage 4 of sleep. Most commonly affects children. The symptoms include sleep terrors, which are different from nightmares. The dreamer of a nightmare wakes up from the dream and may remember details, but a person who has a sleep terror remains asleep. During a sleep terror episode, a person might sit up in bed, scream or shout, kick or thrash, sweat, breathe heavily and have a racing pulse, be hard to awaken, but if awakened, be confused, stare wide-eyed, get out of bed and run around the house, engage in aggressive behavior, more common in adults. Causes are sleep deprivation and extreme tiredness, stress, fever in children, sleeping in unfamiliar surroundings, lights or noise, and over full bladder. Treatments may be needed if sleep terrors cause significant disruption or problems with daytime function and threaten safety. Treatment options include treating an underlying condition, improving sleeping habits, addressing stress, or medication, which is rarely used in treating sleep terrors, particularly for children.
Just didn't seem normal to be sleeping all the time and to only want to sleep. So they would ask me like what my sleep schedule was like, and I would just say I'm sleeping all the time.
One of the conditions I have to evaluate for is called narcolepsy. It's a lifelong chronic disease. The hallmark symptom is excess daytime sleepiness all the time.
The causes are unknown, but some experts think that narcolepsy may be due to deficiency in the production of a chemical called hypocretin in the brain. The symptoms include excessive daytime sleepiness, cataplexy, which is a sudden loss of muscle tone that leads to the feelings of weakness and loss of voluntary muscle control, and can cause speech and total body collapse, hallucinations, and sleep paralysis. And there is no treatment, no cure, but can be controlled with drug treatment.